Hi everyone, this is Sadia Jalisi, and today I will share some interesting facts about oral microbiome. So, we don't have only bad bacteria in our oral cavity, but we do have some good bacteria as well. How many of you guys have ever experienced dental cavities and gum diseases? I think all of us at some point face this issue. That's the reason I thought to dive into this topic. So, do you know the reason that causes all these oral diseases? It's oral microbiome. It includes bacteria, fungi, protozoa, and viruses. And do you know when a baby is born, it's totally germ free. But there are several factors that cause microbiota to develop. First of all, during pregnancy, like diet, antibiotics, host genetic infection, and maternal stress. Then, during delivery, like mode of delivery and gestational age at birth, vertical transmission. Then, when a baby is born, there are several factors that includes feeding mode, maternal diet, and so on that cause infant microbiota to develop like either good or bad. Now, do you know that there is a symbiotic relationship between our oral microbiomes and oral cavity? And this relationship protects our oral cavity and it do not allow bad germs to stick to our oral mucosa. But if there is any like ecological pressure or any change in pH or diet or more inflammation or more gingival clavicular fluid, so it can cause dysbiosis. That means disturbance in these microbiomes. And these disturbance can cause diseases like periodontal disease, cavities, and so on. There are several factors that may cause dysbiosis of the oral microbiome that may include like genetics, activity of salivary proteins, salivary flow immunity, oral hygiene, diet, smoking, and antibiotics. And in causing dental caries in oral microbiome that is mainly involved is Streptococcus mutans and also some Lactobacillus actinomyces and bifidobacteria. They cause demineralization of the enamel and that cause dental caries. And in periodontal diseases, main oral microbiome is Porphyromonas gingivalis, also Treponema denticola and Tenerola forsythia. These are collectively called red complex. And there is a research that dysbiosis persists even after complete remission of dental treatment. And there is some salivary metabolome changes that persist. And so there is a high risk of oral health issues and dysbiosis occur. There are some local and systemic effects because of oral dysbiosis. Like local effects include periodontitis, dental caries, halitosis, sensitivity, bleeding gums, and some are systemic effects as well. Now, I will tell you how can we identify oral microbiome. Like we can do culture and microscopy, and other some other techniques like gel-based technique, PCR, DNA, microarrays, 16S rRNA, and next generation sequencing. Now, I will tell you how can we stop bad microbiomes like eating probiotic rich food like yogurt and boost up immune system, stay hydrated, and use tongue scraper, floss daily, avoid excessive use of antimicrobial mouthwashes, and avoid smoking, fizzy drinks, diets, and so on. These are my references. Thank you for watching and have good oral hygiene and keep your microbiomes healthy. Thank you.